Local university is bringing mental health resources to their students in a new way. Northwest Nazarene University changed the process of how students are seen at their wellness center. In this week's Finding Hope, Lindsay Anmanson explains why they made the switch and how it's helping students.
Before I came, it was much more of a clinic model where there was like a waiting list and you had like a Tuesday morning at 10 and a standing appointment.
When Julie was first hired in 2019, the waiting list for students to see a counselor was often weeks. So she changed the way the Wellness Center works to make it more effective.
The way I do counseling is a lot of solution-focused therapy. And so how that works here is that it's a walk-in model, and one of us is always available for a walk-in session, which is about a 20-minute appointment.
Their new drop-in method gives NNU students the ability to see any of the 4 counselors at any given time in any place.
We just really wanted to make it available. The RDs, the resident directors in the dorms, know that we're available to pop over to a dorm if we need to talk to somebody. I'm often over at the Johnson Sports Center with our athletes or with our coaches working on things. And so the big shift is just making ourselves available for whatever would come up.
As a result, Julie says more students, specifically student athletes, have reached out for help than ever before.
There just always felt like this kind of disconnect almost, like they didn't know that it was also for them. And because it was much more of a mental health clinic setting, it feels like there maybe was a little more stigma to it. And now that we're out on the campus and available to talk wherever. I've done kind of courtside counseling.
Now, prior to every season, Julie meets with each team to talk about how the trainers are there to help them with the physical part and she's there to help them with the mental part. Something that NNU men's soccer coach Adam Pierce said in NNU's mental health series, quote, "It's a tremendous asset, a tremendous resource, and with the pressures that kids feel in general on a social level, having that access or even knowing they have access to it helps reduce some of the stress of it." Lindsay Amundson, Idaho News 6.